Significant disabilities, being unable to talk, a simple cavity can go unnoticed by caregivers for a very long time.
But that person is much less likely to receive regular dental care. Contact 6's Jenna Sachs with the dental shortage being called a crisis.
Deontay Leverett likes familiar places.
I'm gonna walk around twice, okay?
Like this track at James Madison High School, where he does laps.
Good job, buddy.
The nonverbal 24-year-old with autism does not do well in unfamiliar places, like the dentist.
He pushes, he jumps up out of the seat, and it's like lunges.
His mom, Daphne Carr, says a visit to the dentist is filled with Deontay's triggers.
Tap, 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 tap.
Bright lights, strange noises, a medical coat, overhead music.
In his mind, he doesn't really know what's going on, so he's just reacting. And that can knock you down, and someone can get hurt.
That means Deontay requires anesthesia and a dentist with access to a hospital operating room. Not an easy thing to find.
Sometimes you're on lists and you've forgotten what list you're even on because it's been so long.
Deontay has been waiting 2 years to have 2 broken teeth pulled.
There's an odor starting to come from his mouth now. I don't know what else is going on.
Special needs are at a crisis point.
Dr. Patrick Teep, president of the Wisconsin Dental Association, says there's a major shortage of dentists in Wisconsin who can treat patients like Deontay.
We don't have a shortage of dentists. It's dentists that have this specialty training.
Meritor Hospital in Madison used to have a program that trained a handful of dental grads to treat adult patients with complicated special needs. It no longer exists anywhere in Wisconsin. The Dental Association is fighting to bring it back.
To develop a general practice residency requires a hospital that's willing to house that, administration that's willing to develop that program. It's programs that have to become accredited, and then it takes funding to do that.
See if we can slide up a little bit.
Marquette's Dental School is interested in partnering with a local hospital to develop that program.
We're going to clean up the teeth really, really good, okay?
Dental students already care for patients with mild special needs and are on board.
What you really need are some graduate opportunities to give you that next step up and give you that skill set that you can take to, say, like the hospital setting.
We really try to instill service in our students.
But Professor Conrad Nen says cost is an issue for patients and the dentist.
I think there's a financial component to it because a lot of special needs patients have state insurance and dentists don't get reimbursed at a normal rate.
This is not a population where there are thousands of people out there in this scenario. It's in the hundreds statewide.
Open real big.
The Dental Association is asking the state to increase the Medicaid rate for treating patients in this situation.
Both for the physicians, the anesthesiologists, the hospital staff, and the dentists.
I reached out to you because I was kind of at my wit's end and I didn't know what else to do.
Contact 6 was able to help Deontay finally get an appointment with a dentist who has access to Sinai Hospital.
I'm a little nervous but excited. It's been a long time.
The governor's proposed budget includes $5 million for reimbursing dental providers who serve Medicaid patients with disabilities, but it's unclear how exactly that would apply to this situation. The budget does not propose developing a general practice residency. I'm Jenna Sachs, Contact 6.
It's been an interesting